What are Medicaid eligibility rules by state? Medicaid eligibility rules vary from state to state because Medicaid is a joint program between the federal government and each state. While federal guidelines set the broad framework, states have the flexibility to decide specific eligibility criteria. This means that what qualifies in one state might be different in another. Generally, eligibility depends on factors like income, household size, age, disability status, pregnancy, and other special circumstances. Most states use the federal poverty level as a benchmark to determine income limits. For example, many states that expanded Medicaid under the Affordable Care Act set income limits at 138% of the federal poverty level for adults. This means if your household income is below that threshold, you might qualify. These limits are adjusted for household size, so larger families can have higher income thresholds. For 2025, a single adult might qualify if their monthly income is around $967 in some states, while in others, the limit for nursing home care could be over $2,900 per month. Married couples often have higher combined income limits because of spousal protections. States that expanded Medicaid generally have broader eligibility for low-income adults, covering those earning up to 138% of the federal poverty level. Non-expansion states tend to restrict eligibility to specific groups like pregnant women, children, elderly people, or individuals with disabilities. These states might have more limited income thresholds and fewer optional pathways for coverage. Special eligibility categories also exist. Older adults and people with disabilities often qualify through optional pathways, including programs that allow working adults with disabilities to buy into Medicaid by paying premiums if their income is above standard limits but below a certain level. Some states have medically needy programs that let individuals with higher incomes qualify after deducting medical expenses. Pregnant women and children usually have higher income limits to ensure they can access care during pregnancy and childhood. For long-term care or nursing home eligibility, income limits are higher, but applicants must meet medical criteria, and assets are also considered. Spousal protections are in place to prevent the non-applicant spouse from becoming impoverished. Asset limits are another key part of Medicaid eligibility. Besides income, many states requiring applicants to have assets below a certain level. For example, in 2025, the typical asset limit for older adults and disabled individuals is around $10,000 for individuals and about $14,000 for couples. Some states have no asset limits for certain groups, making it easier for some people to qualify. Residency and citizenship are also important. Applicants must be residents of the state where they apply and be U.S. citizens or have eligible immigration status. Some states allow children or pregnant women to apply regardless of their immigration status, which helps ensure access to health care for vulnerable populations. Additional factors include programs that consider medical expenses to help those with higher incomes qualify, known as medically needy programs. Some states requiring premiums or cost-sharing for certain groups, like those who buy into Medicaid because of disabilities. Eligibility rules can be complex for married couples, with protections to prevent the impoverishment of the non-applicant spouse. Understanding these rules is essential for anyone seeking affordable health coverage through Medicaid. Because eligibility varies so much by state, it's a good idea to check with your state, Medicaid agency, or use online tools to see if you qualify. If your income is just above the limit, there might be pathways through medically needy programs or other options to help you qualify. In summary, Medicaid eligibility rules are shaped by state-specific income and asset limits, expansion status, special eligibility categories, residency, and citizenship requirements. These rules are designed to help vulnerable populations access health insurance coverage tailored to their needs within federal guidelines. Always remember to consult your local Medicaid office or healthcare professional for personalized advice, as individual circumstances can vary widely.